Thank you very much. So yeah, there's this idea that we have as people, but it's something real, a real law, this moral law. None of us made it, but we're aware of it. We're aware that there's right and wrong. And this thing, and we're aware at the same time that we haven't really kept that law. So this is, all of us, I think, come with that. We have a sense of right and wrong. This idea of right and wrong, of ethics, Aristotle, he sort of basically said it's a character. This is this inner qualities of our mind and our character that guide us to benefit other people. Another guy, a German philosopher named Kant, he said ethics are the central, the concept of duty is central to morality. That we have a duty to treat our fellow rational beings in a certain way, to respect them. A friend of mine, Dr. Peter Asimwe, as he was speaking about ethics in an African context, he said that the extended family becomes an important part of people one's thinking about what is ethical in the African context. He said you cannot ethically be eating chicken and chips while your people at home can only afford beans. You've got to think of what is your extended family. People are expected to help, but they feel obligated to look for ways to help and look for money in one way or another. There's another guy that I like. His name is Bonhoeffer, Dietrich Bonhoeffer. And he wrote that ethical living is not a matter of a list of rules. And that's one thing I wanted to mention. I'm not going to try and I cannot tell you or whatever the rules of what to do. But it's not a matter of developing a list of rules, but of discerning the will of God in each situation and doing that will. Now, this guy Bonhoeffer was a pastor. He was brilliant, actually, young man. Theologian when Adolf Hitler came to power in the 1930s. I read his biography and I just wanted to, again, remember, I'm not talking about dental ethics, but just some thinking about right and wrong ethics, which is really what I thought we should do rather than just getting into the small details. I read his biography and sometimes these ethical things get a bit tricky. They're not always easy. Here he was in Germany. Adolf Hitler is killing people. He's killing Jewish people. He's killing people he considers inferior, maybe people who are handicapped in various ways, because for him, the key thing was power, and particularly power for the German people. And anything that facilitated that was okay, even if it meant killing people. So Bonhoeffer, here he is a pastor, a Christian pastor, and all of a sudden he's under this guy named Hitler. And a group of them started thinking, this man is killing people, he's destroying our country. And they began to wonder, should we do something? And they started in being involved in a plot to assassinate Hitler. Now he had to answer the ethical decision. Is it right for me as a Christian pastor to be involved in a plot to assassinate country? Now that's not, and I'm not going to tell you what, because I don't know the right answer. But anyway, he got involved. The first try, they arranged for a bomb. They were a fairly large group of conspirators. So one of the, most of them in the army. And one of the generals or higher up army people put a bomb in a plane that Hitler was going to. They'd known about it. They put it in for some reason, and they started the fuse. They knew that in 10, 15 minutes he would be gone. But then they heard he had landed safely. The bomb did not go off. I don't think that bomb was ever found. So they were not discovered. The next try, one of their members said he volunteered to kill himself and Hitler at the same time, a suicide. He had these suicide bombs in his coat, very powerful ones. He knew Hitler would be in this certain room with him. So when just before Hitler came, he pulled the fuses on these bombs under his coat. He knew he had 10 minutes to live. Hitler came in. He started talking to him. Oh, he called him the Fuhrer, dear Fuhrer, whatever he was supposed to talk about. And imagine he's talking to this guy knowing in 10 minutes he's gone. But all of a sudden, Hitler just abruptly walks out of the room for no known reason. The guy is there without Hitler, and the bomb is about to go off. He rushes to the bathroom and pulls out the fuses. He was not discovered. So Hitler's escaped twice. And, I start to ask myself, was God trying to tell them something? But anyway, they tried again. This time they were in a room, a conference room. A guy, one of their members, brought a briefcase, set it on the table, and he walked out. This time the bomb went off. But for some reason, they were at a big, heavy table, and where the bomb was placed, the table was it's a heavy oak table or something. The table protected Hitler from the bomb. And Hitler jumped up and he said, "See, this is providential. It shows that I'm meant to be the leader of this country." So, and that was in 1944. They were in trouble. Hitler was their armies were getting in trouble then, but he felt like he was vindicated. Well, that time, of course, the plot was discovered. The guy that had left the briefcase and had gone out of the room, they caught him, and he didn't last long. They shot him. But Hitler was so furious. They did a big investigation. I'm sure they killed. And finally, Bonhoeffer himself, the pastor, after some time, he was in prison in basic places. And then finally, within the Allies were approaching Germany, and they were about to win the war. But 2 weeks before the Allies would have liberated his prison camp, he was executed by the Nazi government. He was 39 years old. As he was leaving, he told one of his, to be executed, he said, "For me, this is the end, the beginning of life." So did he do the right thing? I don't know, but it shows you that these ethical things are not always easy. I had things in Uganda when I first came. Here we got to Uganda, early 1980s, toward the end of 79. Now my money came from overseas. So I had to change money somehow. And if you went to the bank, as I recall at that time, probably in 1980, the bank would give you 7 shillings for the dollar. I don't really remember for sure, but I think on the street, you would get 70. And you thought, wow, now we're taught to obey the government and honor them, but does that include allowing yourself to be cheated? And a friend of mine said what made him give up, he went to a place, an official money changing place. He gave the guy the money. The guy said, "Hold on a minute." The guy went out on the street and changed the money and came back and gave this guy the official rate, and he pocketed the rest for himself. He decided that, ethically, he was not required to be cheated. So, but these are just examples. Some of these things are not easy to be true. Now, so what are some of my presuppositions? Because this will help you to see why I think some of the things I do. These are things that I assume, and I'm not trying to prove, at least at this point. I assume that there's a God who created the world. He's above the world, but he's also, and he's above and outside the world. He created it. He's separate from the world, and yet he's active in the world. And that's where we get he is ultimately where we get our idea of right and wrong. Now, I'm assuming this. And I'm also assuming that we will all have to give an account to him for our lives. So I'm coming to this subject of ethics with those assumptions. Yours may be similar, they may be different. Now, my friend, Dr. Asimwe, said, he was talking about ethics, and he said, sometimes people say, "Man eateth where he worketh, but man forgets God writeth what you doeth." So, I'm assuming there's an accountability, and that affects what I do. Because I think, whoa, if I do this, I know I'll have to give an account to God for it. It makes a difference in my behavior, for sure. I am assuming that we need ethics, we need guidance, because as we all have a problem of the heart. In Jeremiah, it says, "The heart is deceitful above all things and beyond cure. Who can understand it?" And I assume that though we have this problem of the heart, God can help us. There's another place in the Ezekiel in the Old Testament, God said, "I will give you a new heart and put a new spirit in you. I will remove your heart of stone and give you a heart of flesh." So we have this problem of the heart, but God can help us. And I'm assuming, even though we have this problem, I certainly do, but none of us are as bad as we could be. Even Hitler wasn't as bad as he could have been. Read about him. He's one of his workers, one of his servants was getting married, and he was really nice to him and gave him a bottle of champagne or something. So he wasn't as bad as he could have been. So I assume that we have the heart problem. We're not as bad as we could be. And that the key thing to ethics, I think, is our own, probably I agree with Aristotle on this, I guess. The key thing is our own inward character. All the ethical principles won't help us if we have a character problem. Now, I'm not very experienced in this, but I'm gonna try and share just a little cartoon here. I hope you'll be able, let me start the slideshow. This is just a slide. I'm gonna click, how do I do share my screen? It was somewhere. Let me see if I can find it. Well, I can't find it. Anyway, I may have to paint the picture for you because I don't see share my screen. I'll have to go back, let me go back to the Zoom. And let me go back to Zoom and share my screen, and then I'll put that thing up. Okay, I don't know if this is gonna work, but we're gonna do it. You know what? I didn't practice this ahead of time. I'm sorry. I tell you what, I'm gonna paint you a picture. So just imagine, forget what I told you, I'm gonna paint you a picture. Imagine that you've got a guy standing before a window in a very posh business place, talking to his colleague. Rich businessmen, obviously, looking out a window at the skyscrapers. One man says to the other, I know the difference between right and wrong, but it hasn't held me back. You know, here's a person, he knows the ethics, but it doesn't hold him back because his inward character is an issue. His real goal is probably making money or something, and that's going to become a higher value for him than doing what is right. Now, another of my assumptions, I'm assuming the Bible is a good source. Let me get back into this thing. I'm assuming the Bible is a good source of ethical principles. The book of Proverbs says that it's a guide for gaining wisdom and instruction, for understanding words of insight, for receiving instruction in prudent behavior, doing what is right and just and fair. So I look to the Bible for ethical principles. The Bible, Proverbs, also warns against getting wealth in the wrong ways. It says that things we get in the wrong way take away the lives of those who get it. It's actually harmful to us. One Bible says when you grab all you can get, that's what happens. The more you get, the less you are. So following ethical principles is certainly beneficial to our fellow man, and dental and otherwise, but it's also beneficial to us. Now, one of the most well-known things, and actually one that I really depend on a lot for when I'm trying to make a decision about what to do in the dental clinic, is the golden rule. I think it's quoted Jesus. I hear maybe other people had said it even before him or similar things. But he said, so in everything, do to others what you would have them do to you. For this sums up the law and the prophets. So that rule of trying to treat someone, if I have a patient, I try to think, what would I want them to do for me? If that was my tooth, what would I want? How would I want them to treat me? And then I try to sort of use, that's a very helpful guide to me. Another principle that I like is the one, I guess it's attributed to Hippocrates. First of all, do no harm. If we cannot help our patients, at least we should not hurt them. Now, I'm going to run through just a few things. As much as I'm not going to focus on this, I'm just going to give a little summary of the I'm from the US, and I'm a member of the American Dental Association. And a few things, just to read these for you. I was going to show them on the PowerPoint, but it doesn't matter. I'll read them. So it says the American Dental Association calls upon dentists to follow high ethical standards, which have the benefit of the patient as their primary goal. So I think that's important. When we're working, our primary goal is really to help the patient. Yes, we hope to gain, we need to make a living and so forth, but keep in mind that our primary goal is to help that person. The association believes that dentists should possess not only knowledge, skill, and technical competence, but also traits of character that foster adherence to ethical principles. So even this is a secular organization saying we need to develop character to do the right things at the right time. Another thing is mentioned is we need another ethical principle in their view is to keep ourselves up to date with what we're doing now. Continuing education is a part of it. We can't just say that we stopped learning in dental school. In fact, the truth is we're just starting. Yeah, I think that's enough of that. Now, another thing is the dentist should inform the patient of the proposed treatment and any reasonable alternatives in a manner that allows the patient to become involved in treatment decisions. Now, in the US now, this has become necessary because for legal reasons. You have to give the patient what they call informed consent. And I imagine most of you may do that already. But it's important. We tell them now, listen, this tooth, it has a large hole in it. There's different things we can do. One thing, we can just leave it as it is, open, bend it out, as they say in Luganda. You decide not to do anything. Or we can do a root canal treatment. And if it does that, it should ideally have a crown. Or we can extract the tooth and do an implant. But you try, or maybe do a bridge. But just tell the patient the options and try to really honestly give them, keeping in mind, what would you want if it was your own tooth? Try to think, what would I want someone to tell me? And really let them become a part of the decision making. Another thing is we're obliged, this is still from the American Dental Association, to safeguard the confidentiality of our patient records. Again, in the States, they will fine you big time if you're not careful on this. And I know we need, even in Mango, we need to improve in this, because here we learn some things about people that they may not want other people to know. This person says, I'm on a medication for depression, or I'm taking ARVs, or whatever it is. And I've had patients where the parent is taking ARVs and their daughter is even with them, and they spoke very quietly because their child doesn't know that the mom is taking these drugs. So we have to honor that and respect it, and we need our staff. Our staff have access to some of this privileged information, so we need to be careful on that. And that's part of treating people as we would want to be treated. This other principle, which I alluded to, is called do no harm. We have a duty to refrain from harming the patient. This principle expresses the concept that professionals have a duty to protect the patient from harm. Under this principle, the dentist's primary obligations include keeping knowledge and skills current. Now that's talking about continuing education. We really do need to keep current. We need to know our limitations. This is, I think we'll have a little more talking about this. When to refer to a specialist or another person, and when to know whether it's appropriate to delegate some care for the patient to one of our other auxiliary staff, for example, a chairside assistant or another person who's maybe not a dentist. Do we delegate some of this care to them? It's an ethical decision we need to think about. Dentists are obliged, I'm still going from the ADA, to seek consultation if possible, whenever the welfare of patients will be safeguarded or advanced by utilizing those who have special skills, knowledge, and experience. Now, this is something that our new digital age has really helped with, and I take advantage of this quite a lot. I've been fortunate that I have contact with quite a few specialists in the US, and we have some very good specialists in Uganda, as you all know. We can take advantage of our local specialists. If you have contacts outside, you can take advantage of them. But with the internet, and I do usually I tell the patients I want to consult on this. I'll send an email or somehow pictures of the patient, say, Dr. So-and-so, this is what I'm thinking. What do you think? And it's really helpful. I found that very helpful. It takes a bit of time, but I think it raises the level of care because we're taking advantage of another person's training, their experience, and it will raise the level of your care in the clinic. You still may end up doing the work, but you do it with having had a little backup thinking and maybe confirmation of what you thought or suggestion of maybe a different approach, which has happened to me many times. Now, another one is the ability to practice. I mentioned this. It says a dentist who contracts any disease or becomes impaired in any way that might endanger patients or dental staff shall, with consultation and advice from a qualified physician or other authority, limit the activities of practice to those areas that do not endanger patients. Now, if someone has, I think they're hinting at contagious diseases here. If you have a risk of infecting other people, then you should don't put other people's lives at risk. Now, I'll be honest, it's someone at my age, when you approach my age, another thing that comes in, there may come a time when like for example, at Mango, my fellow dentist may say, Dr. Ken Bombi, maybe you better slow down or do, they'll see that maybe I'm slipping. I was reading about a medical doctor in the States. He told his colleague or colleagues, he said, guys, please, if you see that it's time for me to retire because I'm not quite up to the task, tell me. They told him, and he said he retired the next day. So, and I may, my dear fellow dentist at Mango, or maybe some of you guys will say, Dr. Ken, I'll wait to say that you two said. So anyway, something to think about, but there could be other things. There could be dentists who have an alcohol problem or other drugs that would make them not able to treat the patients properly. And honestly, even if some dentist is too far behind or maybe his equipment is not adequate, let's don't do things that endanger our patients. Another one, this is obvious, again, from the ADA, you should not, we don't offer unnecessary services. I think I was talking to one of our colleagues. She had a patient. This was quite recently. I talked to her, and she had a patient who went to, I think, to Canada. Now, she had checked this person, and they seemed, I think, dentally, they were in good dental health. She went to Canada, had a checkup, and they told them, well, the dentist in Canada said, you need 5 fillings or something like that. And so the patient wrote back to their Ugandan dentist, said, doctor, this is what they told me but you just checked me. What's going on? So when this patient came back to Uganda, the doctor checked them again, just to really be sure, and said, you know what? You really don't need this treatment. So, and I've heard other such stories from the West. Dentists there may sometimes get involved in unnecessary services. Now, I saw a cartoon. I'll paint the picture for you again. Imagine the dentist standing behind the chair. The patient is in the chair with his mouth open, getting ready for treatment. He has a look of a bit of concern on his face. The dentist is talking to his wife. He says, if you've got your heart set on it, honey, go ahead and buy it. I'll find the money from somewhere. And there are other dental cartoons where the guy looks in the patient's mouth and says, Then he goes into another room and calls his travel agent and said, that trip we've been wanting to take but don't have the money, I think you go ahead and book it. So, we've got, we shouldn't be prescribing unnecessary treatment. Yeah, what can I say? Now, just sort of a funny one, but something to think about in ethics. I'm coming to the end here, guys, don't give up. Managing pediatric behavior. I saw that, I'm sorry I can't share it, it's really funny, a cartoon, but I'll tell you, imagine a little boy, probably 12 years old, laying in the dental chair. The dentist is smiling, a sort of a devious smile. He's pointing to 2 drills that he has in there. One is a big, heavy commercial drill like they use for drilling through concrete. The other is a dental handpiece. Now, the big commercial dental drill has under it the words bad boy drill. The small dental drill has good boy drill. And I guess it's implied the dentist is going to say, which one is for you? And, in the past, we've had some of our people, I don't know if I've ever done it, but they said, and you know how kids can be, they're moving around, they're jumping. They said, so that needle's going to puncture your eye if you jump around. So it may be effective, but is that ethical? I don't know. Those are things to think about. Now, so back to the sort of closing things out here. So managing children, I think as we try to do keeping a little perspective, Yes, we want to do good work. I want to do good work, but some of us are perfectionists. I know my father told me once, he said, listen, if you're going to do a filling for me, if you can do a job where the filling will last 10 years and it will take you 10 minutes, if you're going to do a job that'll last 15 years and it'll take you half an hour more, give me the 10-minute job. In other words, for him, he was saying, you know, there's a point where you just want to get the job done in a reasonable way. And a way I've heard it expressed is to see, we should seek excellence, not perfection. You know, I'm still trying, I've been doing this for a long time. I'm still looking for the perfect crown, the perfect root canal, the perfect filling. I haven't reached one yet. So I've kind of given up on perfection, but we do strive for excellence. Sometimes we make mistakes. Sometimes we hit the pulp when probably we shouldn't have. But you know, we're doing our best. And I don't think we have to beat ourselves over the head with guilt if things don't go perfectly. But we do want to do our best. And again, all this in view of treating the patient as we want to be treated. Now, when you're doing crown and bridge, you check that crown, and you know, I'm thinking to myself, I think, wow, that margin, it's not so bad, but it's not so good either. There was one dentist I heard about who said, he said, all my crowns fit. All the crowns I get from the lab, they all fit. Just some fit better than others. And he would get a big drill out and hollow out the inside and stick it on, so it would fit somehow. Well, we don't want to go that far, but we do want to try to do a good job. And I can't tell you, you know, what is the cutoff. I don't know. I don't measure the microns of my gaps and margin, but I try to look at it and think, you know what? And recently I had to do that. I had to redo one. Maybe it was my impression, maybe it was something, but I just said, this is too much. So it's being willing to redo when we have to and eat that cost for us. Root canals is another whole thing. You do a root canal and think, that thing, it's a bit short, or it's a little bit through. Do we redo it, or say, no, it's good enough? I can't give you the answer, but try to just, again, be guided by what is best for this patient. Now, in the end, as my friend Dr. Asimwe said, there's a price for ethical behavior and a prize for ethical behavior. Part of the price, we may give up short-term gain. We see a patient that, well, I could do this, I could try, but really I know I'm not quite qualified for it. And with some pain, you may say, you know, maybe you better go see Dr. Aisha. I think you need to see Aisha. Your orthodontics is a bit complicated. You know, or that's an example, referring when we could do something, but you really think they would get a better job if they go see a specialist. That's an example. Or maybe you say, you know what, we could do a crown for that tooth, but honestly, an amalgam or a composite or a glass ionomer even is going to be very good. It'll probably last almost as long. And you see that money flying out the window, but you also know in your heart you've done the best thing. Now, and sometimes we'll make people angry. The issue of, I forgot to comment on the issue of insurance. I've had patients, probably you guys have too, or you men and women. Patient comes and said, listen, I have insurance, but my friend here doesn't. I want you to do their dental work, but submit it under my name. Now, I had a case once where these were expatriates, by the way, from somewhere in Europe. And I said, I can't do that. And whoa, did they get angry? Because I was blocking them from getting treatment on their insurance for someone that's not even on the insurance plan. But you know, that's some of the price. Sometimes we'll make people unhappy if we do the right thing. But in the end, it'll be worth it. Steve Jobs said, being the richest man in the cemetery doesn't matter to me. Going to bed at night saying we've done something wonderful, that's what matters to me. I thought, you know, this guy, I thought that was good. And he has, you know, he's since passed away, as you know. The Bible says a good name is more desirable than great riches. To be esteemed is better than silver or gold. And that, I think we shouldn't underestimate that, the value of having a good name. Yes, you may have lost the money. You didn't do that, you didn't put 20 crowns on that patient, but you know what? You gave them good treatment, and they eat well, they laugh, they smile good enough, and you've lost a lot of money, but you've helped that person because you've treated them like you would want to be treated. Yeah. And as you know, another thing is to think about your legacy. How do you want to be remembered? I was reading, and I'm a golfer. I like to play golf. And we golfers, and I played competitive golf when I was in school. And my goodness, the pressure and the tension can be quite high. And for me as a young person, that my whole self-identity was somehow tied up in how well I played. So it really affects you. And there's a guy who's a sports psychologist for professional athletes, including golfers. And this guy he would really help them with their game and give them tips. But finally he would come today, he said, now today we're going to do something different. And he pulled a little box out and said, I want you to write on this piece of paper what you want to be written on your tombstone. And, you know, most of the guys, now he was talking not just guys like me who are high school golfers, he was talking professionals who are really high level. But most of them, when they thought about what they wanted, they were coming to him because they wanted to win the US Open, the Masters, the British Open, the PGA, those big four, or even the Ryder Cup. But they came to him for that reason. But then when they started thinking about what did they want to be remembered for, by their family, by their friends, by the community, they didn't write, this guy won all 4 of the majors 3 times. That's not what they wanted. They wanted to be remembered as someone who loved God, who loved their family, who cared for others, who treated others well. So, you know, think about it. As you think about ethics, think about your legacy, think about how you want to be remembered. And so, guys, I think that's it. I've gone a little over my time probably, but I don't know if we need to stop. I'll turn it back over to Dr. Matovu. If there are any questions, or you guys probably have things that would be very interesting comments to make, or maybe things that have helped you in your ethics. So yeah, but I'll thank you for listening, and appreciate you guys. I'm proud to be your colleague. So thank you very much.
All right, thank you very much, Dr. Ken, for the presentation. Thank you very much. That's so nice. Members, any members with questions? As more members are preparing for questions, Doc, I have a question. You have talked about prescribing unnecessary services. There are patients who come with very fine done amalgams, and they badly need to change them for composites. You try to advise them, they badly need the treatment. So how do we deal with that?
That's a good question. Now, I can tell you the American Dental Association take on that. They say it is unethical to remove things like amalgams or any other restoration, by the way, not just amalgam, at the doctor's advice. In other words, in their opinion, it would be unethical for the doctor to say, you know, Mrs. Mukasa, those amalgams you have, yes, they're in good condition, but they're putting you at risk of getting whatever diseases, you know, because they're the American. I know there are a lot of, this is a very emotional issue for some dentists. I don't know about on this platform, but they say because there's no clear evidence of that, they say it's unethical for a dentist to recommend it. And my goodness, you know, some dentists have really made a lot of money that way, at least probably not in Uganda, but in the States, they have made a lot of money taking out amalgams. But on the other hand, if the patient comes, and then Dr. Matovu, I think that's what you're asking. If the patient comes and requests it, then I do what you do. I would say, you know, these things have lasted for how many ever years. If we take them out, what we put in, it may not even last as long. Yeah, but if they insist, then I try to use this. That's not an easy one. I think, well, honestly, this does affect their smile. Maybe it's worth it. But if I do, I tell them, they go in with their eyes open. I say, listen, this feeling may not last as long. It may get other problems. And then, of course, if you're going to do a composite, as you guys know, you have to really do it well. Or any kind of tooth-colored restoration, it may not be as forgiving as amalgam. I wouldn't necessarily refuse to do it unless I think really this is just too much. I'm just hurting a patient. Then I might say, you know what, Mrs. Mukasa, I just don't feel free, but maybe you could try somewhere else. Yeah. Thank you.
Doctor, there's another question. Dr. Ayub, your hand is up. You're welcome.
Yeah, thank you very much, Dr. Chapman, and all the listeners.
Welcome.
I think this is one of the thing which we will need to learn, and that's why we always encourage mentorship in programs like this. Indeed, from the wealth of experience you have, we can really tap a lot into special questions of ethics. We know that in Uganda right now, we have gone down the drain on many fronts. And as a medical council, for which I am a council member and representing Uganda Dental Association, I am very happy to hear this from you and seeing that actually mentorship is going on well. I don't have a big question, but I just want to have a word of encouragement to my colleagues that really we need to get back to the basics of ethics. Many of us seems to be drifting away from our ethical obligations and principles, and we need to revise them as much as possible and put into account if maybe Dr. Chapman did something which you think is unfair. You should be able to objectively and raise a question and say, oh, Dr. Chapman, I didn't understand this, you did A, B, C, D, so that we learn together and we move together. Many of our colleagues actually are bent onto money making and forgetting about the ethical implications of patients first. I would really appreciate Dr. Chapman, Dr. Aisha, whom I've seen on this line. You have been really pinnacles of professionalism. And please continue mentoring the rest of us as we move on. I'm very glad to be part of this discussion. Thank you.
Thank you, Dr. Ayub. Thank you very much. Yeah, appreciate your leadership.
Yes, there is some clarification from Dr. Peter.